global health authorities have shifted their focus to a rare and concerning outbreak of the Andes virus, a specific strain of Hantavirus that has triggered a coordinated international response across several continents. The primary catalyst for this heightened surveillance is a localized but deadly cluster of infections linked to the Dutch-flagged cruise ship, the MV Hondius, which was operating in the South Atlantic during April and May of 2026. This incident has reignited discussions regarding mask protocols in high-traffic transit hubs, particularly after a passenger linked to the vessel collapsed and died at an airport in Johannesburg, South Africa. While the term terror has appeared in some headlines, public health officials from the World Health Organization and the European Centre for Disease Prevention and Control are emphasizing a strategy of targeted containment rather than a return to universal mandates. This reporting focuses on the confirmed developments involving the MV Hondius cluster, the specific biology of the Andes virus, and the precise settings where masks and isolation have once again become mandatory for specific high-risk groups. +2 hantaviruses are generally recognized as zoonotic diseases, typically transmitted from rodents to humans through the inhalation of aerosolized particles from droppings, urine, or saliva. Most strains, such as the Sin nombre virus in North America or the Pumila virus in Europe, do not spread between people. However, the Andes virus, the strain identified in this current outbreak, is the only known hantavirus capable of sustained human-to-human transmission. This capability, though rare and requiring prolonged close contact, is what has prompted the current emergency measures. The MV Hondius began its voyage from Ushuaia, Argentina, on April 1, 2026. It is believed that the index case was exposed to infected rodents in Argentina prior to embarkation. As the vessel moved through the South Atlantic, the virus began to surface among passengers and crew, leading to a complex multi-country tracking effort as individuals disembarked and travelled to various global destinations, including the United Kingdom, the Netherlands, and Switzerland. +2, the situation was formally reported to the World Health Organization on May 2, 2026, after a cluster of severe respiratory illnesses became apparent. By this time, the outbreak had already claimed 3 lives. The clinical progression of these cases has been described by medical professionals as rapid and severe. Patients typically experience an initial phase of fever, muscle aches, and gastrointestinal distress, which can quickly transition into hantavirus pulmonary syndrome, characterized by pneumonia, acute respiratory distress, and shock. The fatality rate for the Andes virus is significantly higher than many common respiratory viruses, often ranging between 30 and 50% in documented outbreaks. This high lethality, combined with the potential for person-to-person spread in confined environments like cruise ships and airplanes, is why health agencies have moved to implement strict monitoring and masking protocols for those directly exposed to the cluster. The timeline of developments reveals a series of logistical challenges for international health agencies attempting to trace the movement of the Andes virus across borders. The index case, a passenger on the MV Hondius, first developed symptoms including fever, headache, and stomach pain on April 6, 2026, and died while the ship was still at sea on April 11. During a scheduled stop at the remote island of St. Helena on April 24, approximately 30 passengers disembarked. Among them was the wife of the index case, who later collapsed and died at the Johannesburg airport after a flight from St. Helena. This specific event at a major international transit hub has led to the current focus on airport safety. Laboratory testing conducted in South Africa and confirmed by the National Institute for Communicable Diseases utilized PCR and genomic sequencing to identify the pathogen as Andes virus. The genetic similarity between the cases, with a maximum of only one detected single nucleotide polymorphism per individual, confirms that the outbreak likely originated from a single spillover event followed by limited human-to-human transmission. +1 in response to these findings, the European Centre for Disease Prevention and Control and the Africa CDC have issued detailed guidance for travel and logistics. For those identified as high-risk contacts, which includes anyone who had close and prolonged contact with a symptomatic passenger, a mandatory 42-day monitoring and quarantine period has been established. This timeframe reflects the long incubation period of hantaviruses, which can range from 1 to 6 weeks. For repatriation efforts, specific protocols have been enforced. Symptomatic individuals and high-risk contacts are required to wear fluid-resistant medical or surgical face masks during transport. On commercial flights where a confirmed case was present, health authorities are conducting contact tracing for passengers seated in the same row, as well as 2 rows in front and 2 rows behind the infected individual. This is a targeted measure designed to address the specific aerosol and droplet risks associated with the Andes strain. As of May 10, 2026, the official count stands at 8 cases, 6 laboratory confirmed and 2 probable, linked to the MV Hondius. The Dutch Ministry of Foreign Affairs, working in coordination with the RIVM, managed the return of Dutch nationals via a specialised flight to Eindhoven Air Base, where passengers were met with immediate screening and instructions for home isolation. Similar measures are being mirrored in the United Kingdom and Switzerland. While some reporting has suggested a widespread return to airport masking, official statements from the WHO emphasise that the risk to the general public remains low. The virus does not spread with the ease of influenza or COVID-19. Rather, it requires the kind of really close contact found in shared living quarters or during the care of a severely ill patient. Nevertheless, for those in the direct line of exposure, the new regime of masking and isolation is a strict requirement to prevent a localised cluster from becoming a broader public health crisis. Public health guidance regarding hantavirus remains rooted in a 2-pronged approach: environmental rodent control and rigorous infection prevention in clinical settings. For the general population, the standard advice is to seal up, trap up, and clean up to prevent exposure to rodent reservoirs. However, the unique nature of the Andes virus outbreak requires a focus on respiratory etiquette and physical distancing for those who may have been exposed. The World Health Organization advises that anyone experiencing symptoms such as high fever, shortness of breath, or severe muscle aches after travel to endemic areas or contact with known cases should immediately self-isolate and notify medical professionals. In healthcare environments, standard precautions are being augmented with transmission-based precautions, including the use of high-level personal protective equipment for aerosol-generating procedures. Plus to the 42-day monitoring period currently in place for travellers from the MV Hondius is one of the most stringent surveillance measures seen in recent years. This period is nearly double the typical quarantine for many other infectious diseases, accounting for the outlier cases where hantavirus symptoms emerge late. During this time, contacts are expected to perform daily temperature checks and report any gastrointestinal or respiratory changes to local health authorities. While they are permitted to go outdoors for mental well-being, they must wear medical masks and avoid mass gatherings or public transportation. This level of caution is intended to manage the inherent uncertainty of a virus that can hide during a multi-week incubation period before progressing to a life-threatening stage in a matter of hours. There are currently no effective antiviral treatments or vaccines widely available for the Andes virus. Supportive care, including mechanical ventilation and fluid management in an intensive care unit, remains the primary medical response. This lack of a silver bullet pharmaceutical solution is why the emphasis on surveillance and early detection is so critical. Experts such as those at the London School of Hygiene and Tropical Medicine have reassured the public that this is not the start of a new pandemic, but rather a sharp reminder of the need for robust global health security and rapid response to zoonotic threats. The limits of current knowledge include exactly how the virus achieved transmission on the vessel, whether through shared ventilation, close social interaction, or contaminated surfaces, and researchers are continuing to analyse the environmental conditions on board. As the 42-day window for the last known exposures begins to close in late June, health agencies will remain on high alert. For more updates on global health surveillance and breaking news, consider subscribing to this channel. The current mobilisation of international health agencies centres on a shift in surveillance strategy, moving from localised environmental monitoring to active screening at major transit hubs. The World Health Organization, in conjunction with the Centers for Disease Control and Prevention, has emphasized that the new regime of mandatory masking at specific international airports is a precautionary measure rooted in the unique biology of the Andes Hantavirus. Unlike its North American relative, the Sin Nombre virus, the Andes strain is the only hantavirus definitively documented to move from person to person. This capability has fundamentally altered the logistical response. In the clinical and laboratory sphere, diagnostic protocols have been accelerated to distinguish hantavirus infections from more common seasonal respiratory illnesses. Reference laboratories are utilizing enzyme-linked immunosorbent assays, or ELISA, to detect IgM antibodies, which indicate a recent infection, alongside molecular testing using reverse transcription polymerase chain reaction to identify viral RNA in the blood or tissue. Because the early symptoms, fever, myalgia, and physical fatigue, mirror those of influenza or COVID-19, the reliance on rapid genomic sequencing has become the cornerstone of current containment efforts. The operational response in hospitals has similarly intensified, particularly within intensive care units specializing in highly infectious respiratory pathogens. Medical guidance issued to clinicians highlights the critical window of transition in hantavirus pulmonary syndrome, where patients can move from a stable prodromal phase to severe respiratory distress in a matter of hours. During this phase, the lungs fill with fluid as the virus causes capillaries to leak, leading to a state of shock and cardiovascular collapse. Because there is currently no FDA-approved antiviral treatment specifically for hantavirus, the focus remains on aggressive supportive care. This includes the use of extracorporeal membrane oxygenation, or ECMO, to oxygenate the blood outside the body when the lungs can no longer function. Hospitals are being advised to maintain strict isolation protocols for any patient suspected of carrying the Andes strain, utilizing N95 respirators and negative pressure rooms to mitigate the risk of aerosolized transmission during medical procedures. Regarding travel and logistics, the mandate for masking in airports is designed to address the specific environment of international flight. While hantavirus is typically contracted through the inhalation of dust contaminated by rodent droppings or urine, the Andes virus presents a risk in confined spaces where close, prolonged contact occurs. Public health officials have clarified that the terror associated with these mandates is a reflection of the high case fatality rate, which historically sits between 35 and 50% for hantavirus pulmonary syndrome. By requiring masks in high-traffic areas, authorities aim to reduce the risk of droplet transmission between travellers who may be in the long incubation period, which can last from 1 to 8 weeks. This extended time frame presents a significant challenge for contact tracing, as an infected individual may traverse multiple borders before showing any signs of illness. Consequently, shipping and airline crews are now receiving updated training on how to identify symptomatic passengers and the correct procedures for the disposal of biohazardous materials on board. The data currently being scrutinized by epidemiologists suggests that while the risk of a widespread pandemic remains low, the potential for localized clusters in urban settings is a serious concern. The discrepancy between public perception and verified scientific data is a focal point for agencies like the European Centre for Disease Prevention and Control. Officials have noted that the virus does not possess the same high on, not, or reproduction number common airborne viruses. Transmission usually requires intimate contact, such as sharing living quarters or providing bedside care without protection. However, the severity of the disease justifies the heightened security at borders. Surveillance teams are also monitoring the movement of host rodent populations, such as the long-tailed pygmy rice rat in South America, to predict potential spillover events before they reach human populations. This dual approach, monitoring the animal reservoir while strictly regulating human transit, forms the backbone of the global strategy to prevent the current cluster from expanding into a broader international emergency. As the international community grapples with the implications of the current Andes virus cluster, the focus has shifted toward long-term prevention, enhanced surveillance, and the practical measures individuals must take to mitigate risk. Public health guidance remains rooted in the fundamental principle of limiting contact between humans and rodent reservoirs. For most hantavirus strains, the primary defense is environmental management, often summarized by health agencies as the seal up, trap up, and clean up protocol. This involves sealing holes in homes to prevent rodent entry, using snap traps to reduce populations, and cleaning infested areas with extreme caution. Crucially, officials emphasize that individuals should never sweep or vacuum rodent droppings or nesting materials, as these actions aerosolize the virus, making it easily inhalable. Instead, the area must be thoroughly soaked with a disinfectant, ideally a mixture of 1 part bleach to 9 parts water, for at least 5 minutes before being wiped down with paper towels. These manual interventions are the most effective way to prevent the initial spillover from animals to humans. In the specific context of the Andes virus and the recent airport mandates, the prevention strategy extends to human transmission. The use of fluid-resistant surgical masks in transit hubs is a targeted intervention aimed at disrupting the spread of respiratory droplets in high-density environments. For those in close contact with a confirmed or suspected case, surveillance is rigorous and prolonged. The 42-day monitoring period is a critical component of global health security, designed to account for the longest possible incubation window observed in clinical history. During this time, the ethical challenge for health authorities lies in balancing the necessity of quarantine with individual liberties. Officials stress that transparency and clear communication are vital. Travellers are encouraged to view these measures not as a restriction of movement, but as a protective barrier for their families and communities. The success of this surveillance depends heavily on the honesty of self-reporting regarding symptoms such as sudden fever, headache, and gastrointestinal distress, which can easily be mistaken for less severe illnesses. The limits of current medical knowledge regarding hantavirus are significant and must be acknowledged to maintain public trust. While genomic sequencing has allowed scientists to track the movement of the Andes virus with unprecedented precision, there remains no specialized vaccine and no definitive antiviral cure. Treatment is purely supportive, and the outcome often depends on the speed at which a patient can access an intensive care unit. Furthermore, the exact environmental triggers that lead to increased rodent populations and subsequent spillover events remain a subject of intense study. Factors such as mild winters or changes in land use can lead to mast years, where food sources for rodents are abundant, leading to population explosions. Understanding these ecological cycles is the next frontier for public health agencies, as they seek to predict outbreaks before they reach human centres. The current situation highlights the persistent vulnerability of global travel networks to zoonotic pathogens that can travel halfway across the globe in a single day. As this reporting concludes, the global health landscape is defined by a state of vigilant caution. The new regime of masking and screening at select international borders serves as a reminder that the eradication of infectious disease is a continuous process requiring international cooperation and scientific rigor. While the current outbreak linked to the South Atlantic is being managed through targeted isolation and contact tracing, the threat of hantavirus remains an endemic reality in many parts of the world. Public health officials urge a